To treat the global psychological reversal, EFT therapists ask the client to locate the sore spots on the chest or lung meridian 1 and to either rub one or both spots in a clockwise circle, repeating the phrase, "Even though I have this problem, I deeply and profoundly love and accept myself," 3 times.
I deeply and profoundly love and accept myself, even though I have this problem. I deeply and profoundly love and accept myself, even though I have this problem. I deeply and profoundly love and accept myself, even though I have this problem.
The next step in Craig's treatment is to use the all-in-one basic algorithm of tapping acupoints on every meridian while attuning to whatever the distressing issue is. The following image is a summary of the acupoints that are tapped along with their associated meridians. EFT therapists suggest that the client verbalize the problem they are working on, as well as tapping on the meridians. So if the problem was a fear, the client would tap and say, "Even though I have this fear." The first point is the inner eye or eyebrow, which is between the nose and the eyebrow. It is usually best to use 2 fingers and tap firmly but not too hard between 5 and 7 times. This acupoint is bladder 1, and a few of the common emotions that are associated with that meridian are paralyzed will or timidity. The second point is the outer eye, which is right on the bone of the outside of the eye. This acupoint is gallbladder 1 and is often associated with resentment or stubbornness. The third point is under the eye, which is the first acupoint on the stomach meridian. Disgust, despair, and codependence are often associated with this meridian. The fourth point in EFT is under the nose, which is the governing vessel 26. False pride, arrogance, and a false sense of self-assuredness are often associated with this meridian. The fifth point is under the lip on the conception vessel, acupoint 24. Shame, guilt, and humiliation are all common feelings connected with this meridian. The sixth acupoint is the collarbone or kidney 27. Most acupoints are bilateral, as is the case with kidney 27s. They are located right under the collarbone. Either one or both of the points can be stimulated. And the kidney meridian, when out of balance, signifies fear and anxiety. The seventh acupoint is right under the nipple on a male and right under the crease of the breast if it is held up on a female. This point is liver 14. Liver is associated with anger and frustration. The eighth acupoint is under the arm, and the point is usually sore because it's a lymph node. This is acupoint 21 on the spleen and pancreas meridian. It is often associated with low self-esteem and a feeling of lack of control over events. The ninth point is the outer thumb, right on the side next to the fingernail. It is usually best to use one finger to do the tapping, but to make sure that the entire area from the tip of the thumb to the knuckle is tapped. And of course should be tapped 5 to 7 times, as each of the points should. This acupoint is lung 11. The lung meridian often is associated with grief and sadness. The 10th point that needs to be stimulated is the index finger. The stimulation on all the finger points is the same, which is on the outer side of the finger and fingernail. This acupoint is large intestine 1 and is associated with being stuck or feeling defensive. The 11th point is the middle finger, which is the circulation sex meridian acupoint 9. This is associated with feeling depleted, confused, or abandoned. Although the ring finger is not an official point of stimulation for emotional freedom technique, it is often easier to remember and certainly does no harm to tap the area on the side of this fingernail as well. This point is triple heater 1. The 12th acupoint is the little finger, which is heart 9, and is often connected with nervous laughter or talking resulting from confusion. The 13th point is on the side of the hand and is often called the karate chop point by EFT and TFT therapists. It is best to take all 4 fingers of the opposite hand to perform the stimulation. This point is small intestine 3, which is often associated with feeling abandoned, lost, vulnerable, and deep unrequited love. The last point is not always used because it is also used in the 9 gamut procedure. However, it can be used in this sequence as well. It is on the back of the hand when the hand is in a fist and is in the fleshy part between the ring finger and the small finger. It is triple heater 3 and is often associated with insecurity, feeling lost, and abandoned. This completes the standard algorithm of EFT. It is used for anxiety, phobias, addictions, traumas, physical problems, and any other difficulties that EFT therapists come across. Just as in TFT, the client is asked to attune once again to the distressing issue and to rate that issue with a subjective unit of distress between 0 and 10. If the client experienced a drop in the distress of 2 or more, the client will be directed to the bridging technique called the 9 gamut.